Dr. LeBlanc, I want to talk what I think is not just a hot topic, what I think is just a very, a topic where patients, in my humble opinion, don't get the straight talk, and because the straight talk is too painful. Here it is.
Yeah.
A person has gum disease, maybe starting with gingivitis, gum disease, full-blown periodontal disease, whatever it might be called.
Right.
It's all the same, an infection in his mouth. And the argument every dentist makes is you're going to lose your teeth. And that's a bad thing. As you mentioned, the best way to replace a tooth is not losing it. However, we have to, at the same token, realize that you dentists have become so good in replacing a tooth that actually it is not anymore such a super big deal. You do implants, you do crowns. It can be done. It's costly and all that stuff, but it can be done. It's not anymore like George Washington, who had a wooden tooth. Apparently, I'm not so sure it happened, but apparently it's a lot better. Here's, however, where I see it. You have an infection, which some of you dentists say is as big as a hand, and it's in the mouth. And it's at the gateway of the blood vessel. It drips into the blood. It has been long time heart disease associated, but there's more. There are kidney failures because it poisons it. There are liver failures. Babies get born premature and underweight. In California, there even was a stillborn baby. A rare incident, but if something so drastically can happen sometimes. Number one, people probably don't always do a biopsy and figure it out, so it probably happens more often than they figure it out. But if it can happen just sometimes, what about the everyday immune system, which must be low, which people for the flu, never mind the swine flu, just the everyday flu which comes, and again, the fatigue, the tiredness, wouldn't that be so much more devastating and dangerous, if it's true what I'm saying, and you're going to tell me how far off I am, than losing the tooth, which is bad enough because, it's bad in itself. But at least this can be fixed. Yeah. How are you going to fix your kidney, your liver, and a stillborn or an underweight baby? How are you going to fix that?
Yeah. Well, number one, Helmut, I believe George did have wooden teeth because they reside in the Smithsonian Institution's Museum in Washington, D.C. right now.
Okay.
But yes, what I find, again, I've been at this for 23 years, what I find is the most common reason a person loses the tooth is from a gum disease, is from a gum infection. And yes, it does affect you. The cardiologists have been putting this together for quite a long time. If you have a lot of gum inflammation, can it affect your heart? The answer they will tell you is yes. And there's more research to support that. So I guess that just adds to why you should really take care of the mouth and the gums. For me, seeing how badly people get along without their teeth and having to go through tooth replacement, that's enough. But these other things, they're there and they're real. I think over the next few years we'll learn more and more about that, and it could be more than we know now. So yes, you want to figure out where you are in the gum disease game. A lot has to do with genetics. I have a very close friend that had gum disease in his 30s. And you ask, did your parents have dentures? Oh yeah, my parents lost their teeth in their 30s. So there's a big genetic component to it, but if we watch it, there's nobody that we've ever seen that if you get them early enough and keep an eye on them and get their habits going a certain way, they can keep their teeth for decades longer. And that's the goal. Because there's nothing like your real teeth. There's no denture, there's no implant, there's no bridge that feels like an 18-year-old's tooth.
Well, also, I mean, any person, if they have a little bit of an infection on their hand, on their toe, ingrown toenail, which is about as big as a dime, they'll run to a doctor, as they should. And then they have a huge infection in their mouth, and only because it basically doesn't hurt and they don't see it, they don't go. And yet the mouth, would you agree that the mouth, the whole gums and, the palate, the cheeks and all that area is the gateway for the blood vessels? I mean, if you want to revive a guy who's like half dead, go and put some drops under his tongue, and he goes like that, right? because it goes straight.
Oftentimes it doesn't. Yeah, oftentimes it doesn't hurt, and you can't. You mentioned the most important thing. You can't see it. We have people come in and they said, "Oh, I lost a tooth the other day." The disease was so bad that it ate all the bone around the tooth to the point where it got loose and it just fell out. But it doesn't hurt in a lot of cases. Sometimes it does, sometimes it doesn't. I like it when it does because then they get aware of it and they come and have it checked out. So yeah, that is one of the things I hear daily. Well, it didn't hurt, or well, it doesn't hurt. And then of course we try and educate and show with the pictures and whatnot, and we show them what healthy is and what they are if they're not healthy, and then just try and get them as healthy as they can be. Some people are willing to work at it. Some people aren't. But hopefully they are, and there's things we can do and they can do to help. And is it a matter of just systemic health or just oral health? No, there's a systemic health factor to it as well.
Right. Well, lately, in the last year, 2 or so, maybe a little longer, but I have heard that surgeons, be it a guy who takes out your tonsils or your appendix, or a guy who replaces your hip with titanium things, the same way you guys use for implants, saying, you know, any type of operation, more and more the surgeons demand a clean bill of health, oral health, because they say, look, if you have gum disease, I don't want to start cutting you because your body is already so weakened with the gum disease that we cannot risk giving it another injury, which every surgery is. Is that true?
It is, you know, especially with the cancer surgeries. There's different types of surgeries where the physicians feel it's more important. But with the cancers, of course, they're weakening your immune system, and your immune system is less able to fight off the dental infections and whatnot. But yeah, it's pretty common that people come in before quite a few different other procedures and say, my physician said that I needed a thorough dental exam to make sure that I didn't have any oral infections. Right. So yes, the surgeons from many different areas of the body are starting to make that some pre-surgical information that they'd like to have.
Well, that should be an indication to the patient to get it fixed. If a surgeon thinks that a gum disease is weakening the body, and now for him not to dare to do something else drastic to the body, that you kind of say, well, then in that case, do I want to run around with it in the first place? I don't think so. Right. Well, thank you very much for your candid information here. Bye-bye.
Thanks, Helmut.